is your marketplace. Why are we out of supplies?
I have no access to personal protective equipment. I don't feel comfortable at all, but I know that my clients need the help.
And one $18 test. 15 minutes later, it claims it can tell you if you're immune to COVID-19.
It'll work its way up the litmus paper inside the cassette and determine if you are negative or positive.
Game changer or too good to be true? Plus, fact-checking Dr. Oz.
Elderberry has been shown to shorten the duration of illness.
And the race to profit from the pandemic.
Olive leaf extract. Those things are gonna kick coronavirus's butt.
On your marketplace. Businesses are closed, parking lots empty. Everyone's being told to stay home. But we're on the way to meet someone still on the road. You're still going to work. Why is that?
I have no choice. I'm a frontline worker. I work in healthcare, and it's my job to ensure that people are taken care of in our community.
Lindsay Couture is a home care worker.
So my clients, they all vary. Some have dementia, some are quadriplegics, some have other health issues that cause them to be immunosuppressed.
Without you, where would your clients be?
My clients wouldn't be able to function.
It's getting even harder because now she's run out of masks and gloves and she can't find any more.
You should be protected. Even going into any client's house, you should be wearing a mask just to ensure that you're not spreading it to them or you're not catching anything from them.
Many care workers say they can't get gloves and masks. Pharmacy shelves bare, hospitals rationing supplies. Doctors and nurses are struggling, but home care workers like Lindsay are too. Now, with no protection, she says her clients are scared. And Lindsay is too. She has to work without protective equipment. She worries that she puts them all at risk, including her mom.
I grew up taking care of my mom, so caregiving is all I knew. I've supported her through 2 double lung transplants since the age of 11. So already having respiratory issues and no immune system, it scares me. But I can't stop doing my job just because of that, right?
Lindsay is not the only one who's worried. Hi, Sarah.
Hi, how are you?
I'm good. Sarah Trick has cerebral palsy and sees personal support workers 3 or 4 times a day.
Without them, I wouldn't be able to get out of bed. I wouldn't be able to use the bathroom.
Sarah is immunosuppressed. She risks exposure in her own home several times a day. She provides staff with masks, but she's running out.
Say I get sick, and then I pass it on to my tenant before I know that I'm sick, and my tenant infect all of their workers. That's an outbreak.
In Canada, nearly 1 million households need home care.
Even if I socially isolate from everyone, I still can't isolate from my care tenants.
Canada's health minister says protective equipment hasn't always been a priority.
We likely did not have enough. I think federal governments for decades have been underfunding things like public health preparedness.
What happened? In Ontario, 55 million masks expired. Plus, in February, Canada donated 16 tons of medical supplies to China. China has given even more back. And the Prime Minister promises more is coming.
We have been able to cover all our needs up until this point and expect to be able to cover our needs for medical equipment in the foreseeable future.
That is not what I'm hearing at all from the frontline workers, not in hospitals, not in long-term care, not in home care.
Natalie Mera is with the Ontario Health Coalition.
People are extremely angry.
Should we even be in this position right now?
No, there has been pandemic planning for a long time. There were recommendations from the SARS Commission and so on. Why were the stocks not looked at? Why was it, not discovered that 55 million masks in Ontario had become stale dated? Why was no effort made then to start procuring supplies? No stone should be unturned because people are going to die.
Sarah hopes home care workers are not forgotten.
It seems like resources are being diverted to hospitals, which is good. However, there are healthcare workers that are still working in the home, and their work is just as essential, and they deserve to be protected too.
Hopefully we can get some answers from Trudeau.
to the government teleconferencing service.
There we go.
Last night, we received a shipment of over 1 million masks. This is in addition to the 10 million masks that have come in over the last days.
But the question is, will any of those masks get to home care workers? We're on the line to ask.
Thank you. The conference is now ended.
Well, it looks like that's it for the questions, but we will still work on getting answers from the government. In the meantime, Lindsay and Sarah need help now.
I know there's a lot of nail salons, a lot of tattoo parlors that have the PPE. I feel like they should be giving those resources to the frontline workers and then being reimbursed afterwards.
So is it that easy? We call tattoo parlors, nail salons, estheticians, and dentists. Maybe masks or gloves that you're willing to donate. Over 70 of them. No luck. All of them are closed, so most don't pick up.
Currently, we have suspended all services due to COVID-19.
But then,
Times Tattoo, how can I help you?
we're wondering if you, as a tattoo shop, may have some of this material.
We do have some. We don't have a lot.
Do you have some that you would be willing to donate?
I think we could.
When these tattoo shop owners hear about Lindsay, they step up.
Tattoos are a want, not a need right now, and what's a need is to keep the healthcare workers safe and healthy.
Chris and Ingrid visit Lindsay at home.
So this is Chris and Ingrid.
Hi.
Why don't you tell Lindsay here what you're doing?
We have some extra supplies, and if they're in demand, then we're happy to pass them on to the healthcare workers. We need to come.
Yes, no problem. No idea how much I appreciate that. Thank you, sorry.
Okay. Ingrid, do you want to tell her what's in these boxes?
We have medical grade disinfectant, soap, masks.
Gloves.
Lots of gloves.
About 1,000 gloves.
It's so hard for, especially a private worker like me, to get any equipment or any PPE anywhere. So you have no idea how much this means to me, honestly. Thank you so much.
We'll inspire more people to do the same.
Hi.
Hi.
Thank you so much for doing this.
As for Sarah, there's a Toronto dentist office stepping up to help too.
Oh, wow. That's amazing. And tell them thank you.
Knowing that I'm protected, that is going to, I can sleep at night now. People care. There's good people in our community, and just got to be hopeful and keep pushing forward.
On the front lines of this pandemic, share your stories. Email us, marketplace@cbc.ca. Next, low on masks, gloves, and testing kits. So companies are racing to cash in on a new test that gives rapid results.
I got the test. Really, already?
We're opening a test that's not even legal in Canada.
These are the instructions. Okay.
Though some say it could be critical in helping control the pandemic.
Instant results in 15 minutes. Okay, so here are the instructions. Open the foil package.
The company that sells it, SafeCare Canada, says all it takes is 2 drops of blood in this kit, that anyone can use it at home.
Okay.
In 15 minutes, the company says you'll know if you've developed antibodies to the COVID-19 virus. Science says that could mean possible immunity. But can it be that easy? And if so, why can't we buy it? As the number of people infected worldwide grows, with no vaccines or cures, the search is on for solutions. Testing is part of that, though none have been approved for home use in Canada or the US. That hasn't stopped people from trying to cash in on the crisis. A Toronto man is busted after a package he sent is stopped at the US border. Inside, illegal home testing kits.
This is a package that it comes in.
Jeff Lester says his test is different.
Poke your finger like a diabetic, put 2 drops into the middle of the cassette here as you see.
And the sooner it gets in the hands of Canadians, the better.
We're all working to try to get this product out in the field to every Canadian as soon as possible.
Lester was selling individual kits for $18 a pop, but had to stop after Health Canada banned him from selling an unapproved medical test.
Our biolab in China has been supplying people around the world. At this point, supplying a lot of products to Italy. We've worked with them on getting a commitment for them to supply us in Canada of up to 1 million of them a month.
These types of tests don't actually tell you if you have COVID-19, only that you've had it. Scientists are trying to figure out if that makes you immune. Here's how they're supposed to work. The tests look for antibodies, a protein your body produces to stop intruders from harming you. The antibodies identify and neutralize things like viruses, such as COVID-19. Once you develop those antibodies, there's a good chance you won't be infected with the same virus again. And that's immunity.
So when COVID-19 came in, it was a desperate need that our biolabs, everybody recognized that we need to do our part to see what we can create and see if we can come to a solution to help release some of the stress that people are facing throughout North America.
We're heading to the home of a leading expert for a second opinion. What do you make of this test? Jason Kindrachuk is a virologist at the University of Manitoba who was on the ground in West Africa during the Ebola outbreak. He says COVID-19 is so new, scientists still don't know that much about it.
If you generate an antibody response, does it mean that you have long-term immunity and you have protection? The simple answer is we don't know. Because the problem is you can generate antibodies that don't necessarily protect you from infection, although they may recognize that virus or that bug when you're infected a second time or infected by something else. And with SARS-CoV-2, we know that so far it doesn't seem like people get reinfected.
SafeCare Canada is not the only one pushing antibody tests. SBL is a Calgary company that's selling its kits all over the world, just not in Canada because of federal regulators.
Due to the high demand for SBL's COVID-19 rapid test kits, please listen to the following information.
Business, it seems, is booming. Kindrachuk worries home antibody tests could give users a false sense of security, though he says they're valuable when in the right hands.
I think it's a great secondary option for clinicians or frontline healthcare workers when they're doing screens because it's quick, it's convenient, that's fantastic. If you're going to roll these things out to people at home, you need to give them a mechanism for how to report this. And that's not necessarily a trivial task. So I think right now, I think we have to take a look at what is the benefit as compared to what is the potential cost of doing these types of things.
Overseas, meantime, the UK is going all in on antibody tests. The government there is buying millions of them.
We're in negotiations today to buy a so-called antibody test, as simple as a pregnancy test, that can tell whether you have had the disease, because obviously it has the potential to be a total game changer.
The tests haven't been approved yet, but the plan is to send them out through Amazon, with priority given first to healthcare workers. In Germany, researchers are preparing a mass study using antibody tests, with the possibility of issuing so-called immunity certificates that could let people return to school and work. Closer to home, in Colorado, an entire county of 8,000 people is being tested for COVID-19 antibodies, twice.
By seeing how the disease is spreading in our county or not, how can we start to lift and allow little pieces of normalcy come back in a way that will still protect our residents and minimize the burden on our medical facilities.
Requires minimal staff training. American regulators are now allowing SafeCare Canada to start selling their tests to labs in the U.S., and the company says it's backed away from trying to sell directly to consumers as it seeks Health Canada's approval. Our regulator says it's still studying the issue, which means Canadians shouldn't hold their breath, waiting to get their hands on one soon.
Can you really buy your way to a better immune system?
Chlorine dioxide, this kills coronavirus. Now go ahead and drink this.
How not to get scammed.
This influenza that is now circling the globe, you're saying that silver solution would be effective.
Quicker than the virus itself, the spread of misinformation.
It's been tested on other strains of the coronavirus and has been able to eliminate it within 12 hours. Totally eliminate it, kills it.
This U.S. televangelist sells bottles of silver solutions for up to $300. A so-called magic remedy for COVID and plenty of others.
They could possibly
help themselves if they find themselves infected with the coronavirus using Miracle Mineral Solution.
The first thing you should be taking is oil of oregano.
Chlorine dioxide, this kills coronavirus. Bye-bye coronavirus, right?
Essential oils have antiviral properties.
Even fancy mushrooms.
Medicinal mushrooms, your chaga, your reishi, your turkey tail.
Watching with us, Professor Bernie Garrett.
Those things are gonna kick coronavirus's butt.
He's got a PhD in information science and studies deception in healthcare, including alternative medicine.
Basically, they're all based on nonsense, really.
Any benefits at all?
None, really, apart from they might sort of make you psychologically feel a bit better. We do know there's a thing called the placebo effect. The dangerous side of that is complacency and people thinking then that these things actually work and then disseminating information to other people that these things work when in fact they don't.
But what message are people getting? We're outside Toronto health food stores to find out.
What are you going to shop for?
Oil, oregano.
Why do you want to buy oregano oil?
Help to make your immunity stronger.
Seems like most just want to boost their immune system during the pandemic.
Mushrooms are great for your immunity. They're full of zinc. Vitamin C also boosts your immune system.
And Dr. Oz shares his tips.
Is there anything we could be doing right now? We don't feel sick, but is there something we could do to kind of boost our immune system?
There are things you can do. So instead of sitting back waiting for bad things to happen, let's take proactive steps. If you do feel ill, what do? Zinc is a great idea. You mentioned it earlier. Vitamin C, elderberry, which is an older solution.
Okay, so what did you think about that?
Most of that is actually not helpful advice. It's important to note most people in Canada are not deficient in any of those substances already. If we look at, most foods like bread, milk, and cereals, things like that, they're all fortified with these. So your intake is pretty good.
The thing is, we're running into people on the street who tell us they take vitamin D, they take vitamin C, they take zinc to boost their immune system. What would you say to them?
I'd say they're probably wasting their money. Immune response is a very complex thing. It's not just simply due to a few minerals and vitamins which you can throw in like magic bullets to boost your immune system. It doesn't work like that.
What would you say if I told you that doctors say, really, there's nothing really that can boost your immune system?
You could say that. I don't believe you, because even if emotionally or mentally it gives me an edge, then it's working. It's up here.
So if it's just up here and you can't actually boost your immunity, why all the claims? Take a look at this site, Eventbrite. Before you could go on Eventbrite, buy tickets for events. Now those events are all virtual. Eventbrite hosts millions of events in more than 170 countries. Okay. So I'm going to type COVID-19. Okay, thousands of webinars that you can watch. Now, some of these seem legit, others, not so much. 5 strategies to boost your immune system naturally against COVID-19. What supplements can I take to protect me during COVID-19?
Hello, welcome to today's webinar.
Listen to this nurse and her holistic team in Illinois.
If someone currently has the coronavirus, will silver help them? Charisse?
So silver can definitely help. I'm not going to say cure because it has not been tested, but it helps in that the way it is able to destroy viruses.
This influenza.
Remember this televangelist? The FDA ordered Jim Baker to stop selling colloidal silver to fight COVID.
It's an awesome company.
But that holistic health team still promoting it on Eventbrite.
We can combine and kind of create an army to attack your virus.
Well, that was interesting. That involves quite a lot of self-deception, and it's very difficult to tell whether people are actually marketing these things for profit knowing they don't work, or whether they actually believe in them.
This was posted on Eventbrite. So what action do they need to take to ensure that this misinformation isn't being spread?
Eventbrite should take action and take this material down, close those accounts.
The nurse doesn't respond before broadcast. The FDA and Health Canada issue several warnings about false and misleading claims, including products with colloidal silver, chaga mushroom blends, and oregano oil. Health Canada adds if you've purchased health products that claim to prevent, treat, or cure COVID-19, stop using them immediately. We tell Eventbrite about the seminars. They say they are now actively investigating and will take down events promoting false claims. And YouTube? After we show them these videos, they remove some too. And from our experts, some proven tips.
Plenty of fruits and vegetables, getting plenty of exercise, trying to maintain stress-busting activities. All of those things are going to help you maintain a healthy immune system.
Have a misleading claim or scam you think we should know about? Send us an email, marketplace@cbc.ca. Marketplace needs you.
This is your marketplace. Around the world, they're ready to take action.
And so they should ignore the measles outbreak.
Absolutely.
Come on.
There it is, 2975 Bloor Street West. And that does not look like a locksmith company.
No.
Look at how big this is.
All of these purses are believed to be counterfeit. Okay, wow.
Why do you have a call center here? Why do you do this illegally?
I didn't expect the levels to change.
I didn't either, actually. Not by that much.
You have something here in Sweden that we don't have in Canada.
Yes.
What would be the most important thing you would tell Canada right now?
Try to educate the public.
Our goal, to get answers.
The ample supply is not making its way to the people at home. There's a gap.
We've been trying to kind of handle that.
What you need to know to stay safe.
Show that you guys care about your frontline workers.
And how to get the deal you deserve.
What?
Have compassion and issue us a full refund.
When your message hits our inbox, it kicks us into action. While many of us are working from home, we can't be together, but we're in this together, and we need you. What should we investigate next? Email us at marketplace@cbc.ca or find us on Facebook or Twitter. Take care, hang in there.